but it is a fundamental right to refuse to have something injected in your body or in your child's body. It's pretty black and white to me at this point. It's hard for me to imagine any other scenario.
Your organization has achieved a significant dent in vaccine mandates.
We didn't do the science. We didn't do the clinical trials. We didn't do the post-safety. But one thing we know it's rare.
Hi, I am Rebecca Hardy, president of Texans for Vaccine Choice. We are here at the Republican Party of Texas State Convention, and Dr. Mary Talley Bowden popped in. Thank you. Welcome.
Thank you. Thanks for having me.
Well, this is going to be a little bit different because one of our volunteers today is one of our doctors on our advisory board. She has been with us in the trenches from essentially day one. And so we're going to have a little doctor chat. We're going to mix it up just a little bit. So Dr. Danielle Gamboa, welcome. And I'll let y'all just take it from here.
Thank you, Rebecca. How are you doing today?
Great. Nice to, we haven't connected before, so this is amazing.
That is correct. I've been following the frontline doctors, and I went to their conference recently. The first question, what first made medical liberty an issue you felt personally called to fight for?
Well, the pandemic was obviously a huge eye-opener. And prior to the pandemic, I was a compliant, good little doctor that followed, mainstream medicine, and I really never gave the FDA a second thought. They were in the background, in the very distant background. But then the pandemic hit, and suddenly what I'm seeing firsthand deviated 180 degrees from what the government was telling us. And I got very frustrated because we had doctors who were dictating treatment protocols from the safety of their bedrooms over Zoom calls. And meanwhile, I'm seeing everything firsthand. I ended up treating over 6,000 COVID patients. And as you know, as a doctor, seeing that many patients with the same disease is unheard of. I'll never see that many again in my career in such a concentrated period of time. And you quickly become sort of an expert in what works and what doesn't. And you probably would also agree that the studies are a jumping point. But what really matters is what you are seeing firsthand. And so I was seeing everything firsthand. And I went through a lot of fighting because of speaking out.
That's right.
And that sort of is where it all started.
You were in the hospital, right?
I was outpatient.
Okay.
So
I was outpatient also.
Yeah. And it all started because I was testing patients. So I'm an ear, nose, and throat doctor. And I was using a lab for my sinusitis patients called Microgen DX, and they do PCR testing for bacteria and fungus. So I was using that for sinus patients, and they came out with a PCR saliva test for COVID. And because we weren't sticking anything up everybody's noses, we became very popular because people wanted to come to us so they would avoid the swab. And so because I was doing all this testing, then I started seeing that the vaccines weren't working because I was tracking people by their vaccine status. And I initially didn't treat that many COVID patients, but when monoclonal antibodies came about, I started treating them with that, and they worked really well. And I could get as many doses as I wanted, and they'd be in my office the next day. And then all of a sudden, the government took over distribution, and they became harder and harder to get.
Yes.
And that's when I started using ivermectin. And I was a skeptic about it because of all the, negative publicity. But I really dug into the safety and made sure it was safe. And once I knew it was safe, then I used it and realized it worked. But I kind of just stumbled all into it. I was a solo practitioner, and but I started speaking out against mandates, and that's when it got fiery.
What impressed me was the censorship. Standing alone in Farmersville, Texas, in my clinic, we were trying to get information on how to treat these patients.
Mm-hmm.
Fortunately, I had been prescribing ivermectin. It's a treatment for scabies, and in the nursing home, it's much safer than the topical treatments. And so it didn't bother me to prescribe ivermectin. And so we started on hydroxychloroquine and then went to ivermectin. But trying to get protocols and that they would disappear off the internet, and I, as a doctor, am trying to get this information, was shocking.
Right.
And so let me just add to what you said. And then why do you believe vaccine choice matters in Texas?
Well, people are quick to forget that vaccine mandates for the COVID shot started in Texas. And Houston Methodist Hospital on April 1st, 2021, 5 months before Biden, became the first in the country to mandate the shots. And I had privileges there. And so when I started speaking out against this, they went after me. But they paved the way for the rest of the country. And I think it was quite purposeful. I think they were chosen. I think they realized that if they could get away with mandates in Texas, they could get away with them anywhere. I think healthcare has infiltrated our state, healthcare used to be primarily dominated by Republicans and conservatives and medical freedom people. But over the last decade, it is now dominated by the other side. And the other side is all about mandates and public health and protocols. And our state is becoming infiltrated with them. Healthcare dominates our country. It dominates our economy. And we have the largest healthcare center in the world, Texas Medical Center in Houston.
Wow.
It's the largest in the world.
And I trained there. I'm a Baylor College of Medicine graduate, and we went back for our 30-year reunion, and I am shocked. They've built so many buildings. It looks like New York City.
Right.
I'm so impressed. And so this is why it's important for conservatives to stay engaged in this fight.
Yes, because, so goes Texas, so goes the country. Texas led the way in COVID tyranny during the pandemic, and nothing has been done to correct it. Now, they did make a law to ban COVID shot mandates, but I'm actually still writing exemptions. I wrote exemptions last week for the COVID shot.
Yes.
So there are loopholes that these institutions are working around. It's usually volunteers or students doing rotations at these hospitals. Somehow they're able to mandate these shots, which are all risk and no benefit. There's absolutely no reason anybody needs one of these right now.
With the information that Senator Johnson is putting out about the VAERS reports, are you surprised that they're still on the market?
Shocked. Yes,
I'm shocked also.
Plus, I can't. I'm sure you could say the same. I can't remember the last time I treated a COVID patient. Like they're just not.
Yes.
It's not an issue anymore.
Yes, yeah. The only reason we test in my office is to know who would benefit from ivermectin.
Right.
Yes.
But it's not common anymore at all.
No. What have you learned from meeting families impacted by vaccine mandates or medical discrimination?
Well, that's what prompted me to speak out, because I had all these people very distraught over the COVID shot mandate, and I was subjected to it as well. But I figured out a loophole, because the language of the mandate stated that you intended to get the shot, and I did intend. I went to the pharmacy and I almost got it, and the line was long, and then I changed my mind and left, and I never went back. But there was a little language in there that made it possible to turn in your form without actually getting the shot. But that's what prompted me initially, because I had patients just very upset about it, not sure what to do. And, it was very new product, untested, rushed to the market. And also, I looked at the study, the way it was designed, and it was up to the clinician to decide whether or not to test these people who'd gotten the shots or placebo, whether or not to even test them for COVID. It was very subjective. I mean, it was based on criteria, but to me, it seemed like they should have just tested everybody periodically to see what was happening, and they didn't do that. And that was I didn't like that, and that was one of the first main reasons I chose not to do it.
Okay. And then why should vaccine choice remain a priority inside the Republican Party of Texas?
Well, it's a fundamental right. It's actually astounding to me that I went along with these mandates for schools for so long. It's a whole paradigm shift thanks to COVID. But it's a fundamental right to refuse to have something injected in your body or in your child's body. It's pretty black and white to me at this point. It's hard for me to imagine any other scenario. I
agree. Actually, the first person I met that did not vaccinate his children was my neurology attending.
Oh, good.
It was 1992 or 3. It was when the Kerrigan skated Harding during the Olympics.
Yeah.
And he invited the team to his family home. And when she broke her shoelace, I asked him, I said, what do you think about vaccines? I had been given information from the moms who would form Defeat Autism Now.
Oh, wow.
And so I asked my attending, and he said, they're too contaminated.
Wow.
They are causing neurological problems. And he chose sometime in the late 80s, because his oldest child was 7, to not vaccinate any of his children.
Nice.
But since he was not in charge of any vaccine programs as a neurologist, he did not share this information with other people. And I think both of us would be surprised at how many doctors throughout these years have chosen not to vaccinate their children, but not say anything to anybody.
So when did you wake up?
So I would have wished that I would have woke up in that moment, considering he was my neurology attending, and the people he saw were MS, Parkinson's, in ALS, in-stage neurological diseases. But unfortunately, I did not. And so my children got a modified vaccine schedule, but my youngest was harmed by the MMR.
Oh, no.
And he's fairly severe. Now, he has improved. But to think that was 20 years ago, and there was, if there's a vaccine clinic open today, there's some child in this world that is getting the same harm from their vaccine. And to think that that's going on right now gives me the passion to stand here in this booth and spend my time to get this message out.
Yeah.
And so, and then what is your message to the Texas for Vaccine Choice grassroots army?
Keep at it. It's a slug. I feel like we're gaining ground, but it's constant fighting. I feel like it's constant.
Yes.
It's just keep the pressure up.
Okay. And their last question, finish this sentence. Medical liberty means
bodily autonomy.
Yes, I completely agree. Thank you very much. It was very nice to talk to you and meet you.
Likewise.
Yes.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.